I'm Dr. Kalpana Muthusamy. I'm the endocrinologist here at Olmsted Medical Center. I've been working here for 5 years now. When it comes to diabetes, there is a lot of treatment options available. The drugs are still secondary to lifestyle changes, particularly when it comes to adult onset type 2 diabetes. So we still want our patients to exercise and ideally 150 minutes a week, kind of spread it over 3-5 days. Also, again, as guided by our dietitians, choose the right dietary choices. We emphasize that because a lot of people in the beginning particularly might not need medications if they are able to make effective changes. If they ultimately need to be on medications, we pick and choose the drugs based on what kind of blood sugar pattern our patients have. Some people have blood sugars that are higher in the morning, some have later in the day that are higher after they eat a meal. And the drugs work differently, and recently there is also an emphasis on another hormone involved in diabetes called Glp-1 hormone. It's a hormone that along with insulin plays a very vital role in regulating a person's blood sugar. So there are some drugs that can either deliver that hormone or they can indirectly get your own body to make more of it. And finally there is insulin. And apart from the type of blood sugar pattern, the choices of these drugs can be based on whether, what patient prefers, because some of them are pills, some of them are injections, some of them can cause low blood sugar reactions. So particularly if somebody lives alone or an elderly patient, there are medical problems, and again, the type of work they do, we have to be careful in avoiding a low blood sugar reaction because it can be very distressful but also unsafe at times. And finally, cost is always a big factor. We cannot forget that these are, that diabetes is a chronic disease. Some of these medications will need to be taken for a very long time. So we always have to factor in the cost. So these are some of the examples of factors that go into that decision making, and there are some decision making cards that are available where a patient would be able to look at all of these at a glance that will help them make a decision as to what might be appropriate for them. Use of insulin is kind of felt to be really a last resort by many patients, but also a lot of doctors, and that decision is delayed quite often because of fear of needles, just the perception that somehow insulin should be avoided until the very end, and a lot of people might even see that as a sign of failure that they've had to start insulin. But I think it's important for people to understand that it doesn't have to be that this implicates personal failure, but the disease progression itself requires use of insulin at some point, despite the patient's best efforts. So factors to consider. There are several different types of insulins. Everybody's day-to-day activity, work, mealtime routine is very different. So choosing the right type of insulin program to match their routine is very important. And again, cost should be a factor that has to be taken into account. Fear of needles is a big factor for some people, but really there has been a lot of advances with insulin delivery. We have insulin pen devices that can, at the click of a pen, deliver insulin very easily. So it's very portable. People can take it with them, transport it without any difficulty. And the needles really have gotten very small. Most people who feared insulin subsequently went on it, they come back and say that it really wasn't a deal breaker for them. Not delaying insulin use is very important because waiting longer to initiate insulin might add several years of uncontrolled diabetes, which can create organ damage, which has larger implications. And insulin, when trained appropriately and when used consistently, can be very safe and a manageable option for most people. It's the fear that needs to be overcome with the help of the doctors and the diabetes educators who are involved, and they can really be supportive to the patients while they start that journey. With diabetes, I think the main thing we have to acknowledge is it's a lot of hard work. Life as is feels crazy. We're all busy, and on top of that, when you add exercise, you have to count your carbohydrates. When you do different things, your blood sugars might behave differently. You got to check your blood sugars 4 times a day. Some people are taking insulin 4 times a day. So it adds a lot of burden to what they do. And that's an important part of where diabetes will head in future. And we have actually seen a lot of progress. We have devices called sensors which can continually record a patient's blood sugars. We have insulin pumps that can be worn on the body and that can continually pump insulin. It allows people to be quite flexible with their activity, with their meal routines, and you can make minute-to-minute changes as you need. So you're not stuck to the insulin dose that you took that morning. And we also have what we call a closed loop system. Basically, when the monitor, the sensor records a low blood sugar, the pump would be alerted and the pump would stop insulin infusion. And this is a huge safety measure, particularly for people who cannot sense that they are having low blood sugar reactions, which can be a problem the longer a person has diabetes. This closed loop system, which we have seen work very well for a lot of our patients, can be a great reassuring factor. And they are making a lot of progress in that field, so they are expanding that to how quickly the blood sugars drop, which can be another factor in regulating their insulin pump delivery. And that field only will continue to grow.